Everybody. Hi, everybody. I'm Dr. Carolyn Alexander at Southern California Reproductive Center, and we have such a special, wonderful guest, Cory Ruth. Would you like to introduce yourself?
Sure, yes. My name is Cory Ruth. I am a registered dietitian. I specialize in PCOS, and within that, weight management and infertility. So yeah, I'm very, very happy to be here. This is my passion. This is what I love to talk about, and it's exciting to be able to be here.
Great. I always learn things from you, and I'm so happy today. I've been looking forward to just seeing you and have a little FaceTime too. If you could go back, Brittany, on the slides, we're going to talk about optimizing our fertility and finding the golden egg, and how important nutrition is. Nutrition is kind of like medication and medicines, and it does influence our egg quality as well as ovulation, our overall sense of well-being, and cortisol and stress. So next slide. I'm born and raised in Los Angeles. I went to UCLA, and my passion and research has been on polycystic ovary syndrome, as well as recurrent pregnancy loss, cancer patients who are going to face fertility issues with chemotherapy and possibly surgery. And so we talk about fertility preservation. I'm very proud to be part of a wonderful team here at SCRC, and our embryology lab works tirelessly to help people get the healthiest and best quality eggs as well as embryos. And it's just an honor to be here today. Slide. My team works very hard with me every day. We care about every single patient and put all our heart and effort into helping fine tune the best protocols for your specific situation. Next slide. Okay, Cory, go ahead.
Me.
Yeah. Oh, there's another slide. Oh, sorry. So our lab has been here since 1999, and our facility is a united team where our embryology lab is right here and our clinic's here. And then we've had the first floor so patients can come in and out and get to work on time, get back to their family, whatever they need to do. We have our lab and clinic in Beverly Hills. We have a Pasadena office, as well as a full embryology lab and clinic in Santa Barbara. And we do telemedicine to all over the world. Our lab has experienced and certified directors, a double witnessing verification system, blastocyst culture, so we grow the embryos for 7 days. We do vitrification, which is called flash freezing. We do biopsies of the embryos to check for aneuploidy screening, as well as monogenic diseases or single gene disorders, such as sickle cell disease, cystic fibrosis, Gaucher's, all those things. The EmbryoScope is a time-lapse video that monitors the embryos over the 7 days and helps us differentiate which embryo might be a little better than the other embryo. We use it in specific situations. Next slide. And this is a picture of our beautiful facility. I love working here. It's been really a joy, and I love our teammates. They make the day better, and our patients who are really going through a lot, we're here holding their hand, trying our best to get them the best success. All the physicians, all the teammates work on that. Next slide. Okay, so Cory, your turn.
I'm first. Okay. So a little backstory on myself. I have PCOS, and that's what led me to get into this line of work. I was already on my way to becoming a dietitian, and I was just struggling a lot with my own PCOS related issues. As most of you may know, PCOS is a leading cause of infertility. So, some of us think that pregnancy and, pregnancy outside of working on, with fertility treatments, it is impossible. But it is possible for most of us. And many of us struggle with anovulation. So we're not ovulating regularly on a consistent basis, and that can basically lead to problems getting pregnant, because we have to ovulate to get pregnant. So I was struggling a lot with all of my own PCOS issues, and as I was becoming a dietitian, I thought, okay, I really want to open up my door, my private practice. And the one thing that I will never go into is PCOS because it's so complicated. I don't want to even go there. I know how complex it is. But as I, went along in my journey, I started to realize what a huge connection there is between our diet and what we're eating and how we're eating and nutrition and our health and our fertility and PCOS. So I thought, you know what, I kind of am the perfect person to step into this space because here I am already, a registered dietitian. And not only that, I have PCOS too. So I know exactly what it's like to struggle. And I want, the women that I work with and the women that follow me on my, social media pages and my website, I want them to skip a lot of the struggle that I faced. So I work with women with PCOS on weight management. I work with them on fertility and really making improvements on their symptoms and, through kind of lifestyle and dietary changes. So next slide, we'll go into a little bit about the connection between what we're eating and fertility. So some of the popular questions that fly into my inbox are, what do I eat to get pregnant? So it's not as simple as just eat this and you're good to go. Green light, baby. It's more complicated than that. If it wasn't, then I wouldn't have a job, probably. And there really is no one diet that is going to work for every single person. However, we'll talk about a pattern of eating that can be helpful for everybody. And just kind of main points is it includes lots of antioxidants that can be helpful for egg quality. It includes enough protein and fiber that's helpful for blood sugar balance and your hormones, regardless of PCOS. We're not really talking exactly about PCOS here. And it's one that incorporates a wide variety of food and nutrients so that we're getting enough vitamins and minerals, and we're also getting enough fats. So, we have lots of research that shows that eating a fertility supportive diet and, coupled with certain lifestyle changes, that this can help boost our chances and it can help prep our body for pregnancy. It can make pregnancy a smoother, more enjoyable experience as far as things like gestational diabetes goes and pregnancy weight gain and postpartum, all of these things. So another question or another thing that I kind of tackle from questions and people, DMing me on Instagram and things like that is, someone is already going through fertility treatments, say they're already on the path to, IVF, and they're saying, I don't even know if this will even be helpful. So one is not replacing the other, right? We can absolutely, working on a healthy diet and your nutrition is not going to be harmful. It can only help your journey. So I always say it doesn't have to be a sub. It can be supportive of the fertility treatments that you're already doing. So when we're talking about kind of a typical, we call it the SAD diet, which is kind of sad, the standard American diet, the Western diet. Just over the years, the way that our food system has evolved, is a lot more towards convenience, which means that we have higher calorie foods, basically more calorically dense foods, more fast foods, more, air quotes. I hate, if you follow me on Instagram, you'll know that I hate the word processed foods, but we'll just use it here because I think y'all know what I'm talking about when I say it. Empty refined carbohydrates. So they're stripped of fiber, a lot more saturated fats. It's lower in fresh fruits and veggies and whole grains and seafood. So a fertility supportive diet in general is kind of the opposite of that, of where our food system has gone. It includes more fruits, it includes more vegetables, whole grains, seafood, nuts and seeds and beans and lentils and things like that. So if we're talking about infertility due to anovulation, here's another big link. And this is the case with PCOS, which research estimates about 10%, maybe higher, of the female population has PCOS. A reduction in weight when warranted, of course, of even 5 to 10% through diet and exercise may restore ovulation and help us get pregnant. So there's lots of links, when it comes to how we're eating and our chances of a healthy, successful pregnancy. So next slide, we'll get into a little bit of the nitty gritty, what I can call the 10 fertility and nutrition commandments, because again, just like Dr. Alexander said, they are so linked. So the first one is your meals. Your meal composition should include a protein. If you are somebody who eats plant-based, if you are a vegetarian or even vegan, this can be a lot harder to do. And, there's all these things on social media about, oh, I'm plant-based, but I get enough protein. Don't worry about me. And that may be true for you, but many, many, many times, more often than not, when I see somebody, when I really go through what they're eating, they do lack protein. If they are not including any meat or dairy or fish or eggs, it's just harder to do. So you really want to focus on getting that protein in, and that fiber can be so helpful, not only for digestion. We all think about fiber and digestion, but protein and fiber are such a magic little duo for balancing our blood sugar, and that it has a direct impact on some of our hormones. We want to have fats in our diet. Not all fat is bad. That the difference between saturated and unsaturated fat. Saturated fat comes more from meat, kind of products. We think red meats, right? Unsaturated fat would come from more plant-based sources, like think nuts, like peanut butter. We need both, actually. So not all saturated fat is bad. That does not mean you should go eat 9 steaks a day every day. That's not what I'm saying. But it's okay to have some saturated fat in your diet. Our sex hormones are built from cholesterol, so that's okay. And then we want to have a serving of carbs. And, if we think about that standard American diet, say we go to dinner at an Italian restaurant, we get breadsticks before we get our meal. We get pasta. Maybe it has a little bit of veggie in there, maybe some protein. You got to pay $8 extra for that, right? And then we have a cocktail or a glass of wine. We have some croutons with our salad and maybe a dessert. We've got carb, 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 carb. So it's easy to overdo it on the carbs because, and not all carbs are bad. That's not what I'm saying. Carbs are good. But it's easy to overdo it, just again, because of the way that our food system is set up. So we're trying to keep our carb serving to just a moderate amount, nothing crazy, but we still get our carbs in. So you're really looking at your plate and you're saying, do I have these 4 things? Protein, fiber, some fat, and some carbs. And your fiber, that's going to be, what I like to call your low or non-starch vegetables. So we're getting our veggies in. Okay. Number 2, we're trying to keep caffeine. We can have our coffee, we can enjoy our coffee, but because we have such conflicting research, my general recommendation is trying to keep coffee to 1 cup per day or less. Number 3, we're trying to get in at least 25 grams of fiber every day. And that can be harder to do than you might think, because if we are eating that standard American diet, we see typically the average American's getting like 11 to 15 maybe grams of fiber a day, which is not great. So really trying to get that fiber up. You can add in chia seeds, flax seeds, psyllium husk. You can eat more beans and lentils, veggies, whole grains. These have the fiber that your body and your hormones and your fertility are going to thank you for. Number 4, we're choosing complex carbs. So we don't like our empty refined carbs. We're trying to pick more complex carbs because they include some of that fiber. Not to say we can never have the other ones. We totally can. Like, I'm not saying never eat white bread. Like, that's ridiculous. But if we're doing white bread every morning, we might think about switching to whole grain to try to get that extra fiber and some of those phytonutrients that are in there. Number 5, I love the 80-20 rule. We learn about this a lot when we become dietitians. 80-20 rule is basically 80% of the time we're eating how we want to be eating, and that 20% of the time is really leaving some room for fun. So with this kind of perspective here, we want to try to cook 80% of our food at home. So try to limit how much we're eating out. And the reason why is because there's so many more calories and sugar and sodium and saturated fats, trans fats out there than when we're eating and we're cooking the foods that we're making in our own kitchen. That is a really easy, one of the best tools to implement in terms of getting enough nutrients, because we have control of what goes in our food. And generally we find that we could eat kind of the same similar thing, but it's a lot healthier for us if we make it ourselves. make leftovers, utilize those leftovers. That's a great tip. Number 6, of course, taking a high quality prenatal. I love a prenatal because it helps kind of fill in the gaps nutrition wise, and not all of us eat perfectly 100% of the time, myself included. Full transparency. Number 7, aiming for a healthy weight, of course, like I said, for someone with PCOS, just 5 to 10% reduction in weight, if it's warranted, may help jumpstart ovulation. So it's one thing that we can potentially pull out of our tool belt. Number 8, if you are not physically active, get into a groove. You don't need to become an Olympic athlete. This is not about hitting the CrossFit box 7 days a week. This is about moving our bodies in a way that feels good for us. That could be a walk, a hike outside. The weather's warming up. Well, at least here, I know if you're in SoCal, it's probably nice already, but it's just warming up here. So getting outside, getting that vitamin D in is amazing. Number 9, of course, easier said than done, stress reduction and self-care. In our busy, fast-paced lifestyle, we really want to focus and prioritize on that stress reduction, whatever that looks like for you. It's going to be different for everybody, right? For me, I love a hike outside, a hot bath, those 2 things, amazing. Number 10, we're trying to sleep every night for at least 8 hours. 8 to 9 hours is kind of the sweet spot. I know that's like a boring tip, but I cannot overstate, the importance of sleep when it comes to hormone health and just generally like mood and energy, all those things too. But it is a powerful tool, and a lot of us are guilty late night scrollers. So think about that and try to get those 8 to 9 hours in on at least a regular basis, as much as you can. Next slide. So like I said, there is no one food that we can eat. There's no one magic bullet, like eat some pineapple, this is going to work. You're going to implant and you're going to have that baby. That's not how nutrition works. So we really have to tackle fertility and nutrition from an integrative approach. So it's my professional opinion as somebody who works in nutrition and fertility, that a nutrient-rich diet that nourishes our reproductive organs and our hormones is the foundation food that increases fertility. So this is really where we want to come from. There's no one magic food. It's really a variety of all of these foods together. So researchers have estimated that we make roughly 227 decisions about food every day. That's kind of crazy. That gives us 227 opportunities to make the best decisions, right, for our reproductive health, and to choose foods that will enhance our fertility, nourish our hormones, our bodies, and promote healthy pregnancies. So this is also, I think that's a heavy statement too, because for some of us, we can internalize that to be, I need to eat perfect, right? I need to eat perfect all the time. If I mess up, I'm totally, derailing, and I'm not going to get pregnant. That's also not how nutrition works. One meal is not going to make or break your journey. One vacation is not going to make or break your journey. It's progress over perfection every day. So when we're making these, food choices, if we're making a healthier choice, we have to pat ourselves on the back and say, yeah, great, I did that. And I did that because I want to get pregnant and I want to have a healthy pregnancy and a healthy baby. If we don't make that best choice, we can say, I'm going to give myself grace because tomorrow there's going to be 227 other decisions I can make and opportunities to nourish my body. So looking at it that way is, I think, the healthiest kind of perspective. This list of foods is not the entire list of things that are great when we're talking about nutrition to conceive, but these are really kind of shout out superstar foods that you can think about incorporating in. Of course, the ones that you love, don't force yourself to eat the ones you don't love, like oysters. I love oysters, but that's a polarizing food, I feel like. But these are really great for hormone health, for blood sugar, for blood flow. So beets, oysters, kombucha, I made a little note, low sugar, because there's lots of kombucha brands out there with a ton of added sugar. Again, not that that's the devil, but just something to be mindful of if we're working on nutrition. So there's brands that are lower sugar, like one I can think of is called Hum, H-U-M-M. That's a great brand. So low sugar kombucha, tons of good probiotics, ginger, lots of good anti-inflammatories there, sweet potatoes, lots of vitamin C, lots of fiber for healthy blood sugar, persimmons, that vitamin C can be really helpful for ovulation and for progesterone outputs. Cod liver oil has a ton of things. Liver in general is also like a superstar food. That's a common joke amongst dietetics, is that liver is good for everything. Almonds, mushrooms, ghee, these are great foods that you can think about adding in. So think about adding foods to your diet rather than thinking about eliminating and cutting out whole food groups. Because when we get into that mind space, that mindset, we all hear like eliminate gluten, eliminate dairy, eliminate sugar, salt, like what's next? Joy? Like we have to enjoy this process. We have to enjoy our lives. So look at this list as things to add rather than thinking that you have to cut out XYZ things, because research really doesn't support that. Research supports like I said, a whole foods diet that has lots of fruits and vegetables, fresh foods, plant-based foods, but also, we can include meats and fish and shellfish, lots of protein and fiber, lots of color. When you're at the grocery store and you're looking in the produce section and you're like totally uninspired, I just love to go for the rainbow. I pick something colorful. Like I found some red carrots the other day. I found some purple cauliflower. These are like fun things. They're like, oh, those are pretty. So go for the color, because the reason why fruits and vegetables are the colors that they are is because they have separate what we call phytonutrient profiles, right? So the reason why an orange bell pepper is orange and a purple cauliflower head is purple is because they have different phytochemicals. That orange bell pepper has the, why am I blinking? Beta carotene, thank you. And then the purple cauliflower has anthocyanins. Those are different antioxidants. They have different properties. They have different benefits for hormone health, for fertility. So getting all of that wide variety is so helpful, just from a kind of, this big bird's eye view look at what to choose for healthy hormones and fertility. So I hope that is helpful. And now we're going to the next slide. Perfect.
Thank you, Cory. Yeah, you inspired me. I love beets, but I feel like I don't buy them that much, or but I'm going to add it to my salad that I've planned for my lunches and things. Thank you so much. You inspired me. And I think it's also true. I tend to be a creature of habit when I do breakfast, lunch, but then sometimes when I get home, if I've had a lot of procedures and thought a lot about patients, I want to eat something, then I feel so guilty that I cheated. Why did I do that? But ultimately, it's to think of nutrition over the 7 days that really helped me put it in perspective. That I tell patients that, but sometimes it's hard when you're thinking about it for yourself too, So I love this slide, but this is the slide of the natural ovarian aging process. And if anyone has questions, please put them in the chat or in the Q&A. We're both going to be here to answer any questions. And what's fascinating is when we were a baby in our mom's tummy was when we actually had the highest number of eggs. And then it started to go down. And then at puberty, we had about 400,000 eggs. I still think that every month there's always a chance for the good eggs. During our fertile reproductive age, there are about 400 to 500 oocytes available. And this is a picture of the microscopic egg there. And this is the ovary. This is a microscopic view. And then as we get towards 50, as I'm nearing there, this is the lower number of potential eggs that we have, or follicles that have the little microscopic egg inside. I tend to have a philosophy. I'm always a positive vibe, but that's good. And I want to be realistic too. But at the same token, it feels like for every set of follicles, there should be hopefully good eggs there. Next slide. In terms of the patient evaluation, we do a detailed medical history. We talk about your pap smears, how your periods have been, whether you've been on the birth control pills for years and years or not. And there's good and bad with both situations. We talk about the IUD, breast exam, family history. We check your genetics. So both of you and your partner should get checked for genetic carrier screening for common autosomal recessive diseases, as well as X-linked issues like Fragile X that can impact your ovarian reserve. We do a physical exam and want you to have your annual physical with your primary care doctor. Even though COVID caused a lot of people to sort of postpone things and not necessarily get their checkups. It's really important. And now even with colon cancer screening at 45, it changed from 50. We used to think, oh, it's all at 50, but now it's 45. And the average age of patients we see here is 39.9. So half of our patients are younger and half are over 40. And then a detailed diagnostic testing. So we really want to talk about the anatomy, the fallopian tube, the ovarian reserve testing, as well as looking at the uterus for adenomyosis, which is endometriosis in the uterus. I have found a lot of nutritional things help that as well. And then also look for any fibroids or polyps or any scar tissue if you've ever had any surgeries or procedures in the uterus. Next slide. So blood tests are really important. And one of the tests that patients ask us a lot about is, I want to check my egg supply. That's the AMH, anti-Müllerian hormone testing. It's not a perfect test. We use it in conjunction with your age, your FSH on your second or third or fourth day of your period, as well as the estradiol, as well as the antral follicle count. AMH does not predict when you have unprotected intercourse if you'll get pregnant. I know for myself, my AMH was relatively low at the time in my later 30s, and I still conceived, but it's a test that helps us decide which protocol should we pick when patients want to protect their fertility and talk about egg freezing, or if they're at the point where they've tried many different fertility treatment options and want to discuss in vitro fertilization. We use it as a tool to guide us. These are the normal AMH ranges, and I've seen some consults where they're really, really low and we still got them 2 healthy kids. So I don't want patients to lose hope, but AMH at any age, any time, we're hoping for it to be above 1.5. A general rule of thumb is 2 to 8 until we get over 35, then it starts to go below 1.5. And then when we get towards 40, normal can vary from 0.4 to 1.4. But again, the general set point is we're trying to get it at 1. After age 44, traditionally, we see AMH go down. And we talk about all the different treatment options when patients come in at a bit of into their mid 40s. And it's really important, again, to have your annual physical exam, make sure you're up to date with your pap smear mammogram and Cologuard or colonoscopy. Next slide. In terms of options that we do here at SCRC, egg freezing, we have healthy babies from eggs from 12 years ago. In the past, we used to say to please try to use the eggs within 8 years because we didn't have long-term data on it. And now that we've had a longer experience with it, we're noticing the eggs can stay in a flash frozen vitrified state for longer than expected. Embryo freezing, which is a fertilized egg. Sperm freezing, so men around age 45 are opening up the conversation that maybe they're not ready to start a family yet, they haven't met the right partner, or they're deciding what to do for their future. Some of them are freezing sperm younger because there's some evidence that after age 50, sperm quality changes, as well as autosomal dominant disorders, risk of autism, risk of schizophrenia goes up. And so it's good to think about that and talk it over with people, you know, and primary care doctors are talking about it more now. IUI is intrauterine insemination. IVF is in vitro fertilization. Some of our patients face challenges, medical medications that they're taking, or if they've had an emergency hysterectomy after a C-section, had bleeding. There are many different reasons why patients need a surrogate. And so we talk it out with you in detail and discuss the best ways to find a healthy surrogate. Donor eggs are an option because some women can have premature ovarian insufficiency or even premature menopause, and it's not your fault. It can be sometimes genetics. It can be environmental toxins and plastic and pollution. We don't know why we're seeing a little bit of this on the rise, as well as donor sperm for same-sex couples, and as well as some partners have no sperm and their genetics reveal that we will never be able to get sperm from some Y chromosome microdeletions. And so we're able to help build their family goals with sperm donors. Next slide. Okay, how do we do an egg retrieval? So I always say it takes a preparation. So once we meet and discuss, it's important to take your vitamins, change your lifestyle. If you're not getting a little sweaty or cardio in every other day, at least do 20 minutes. You can do more than that, but you really want to have your circulation moving so that the ovaries get good blood supply. You want to make sure you're having good night's sleep, as Cory mentioned, adding in lots of colorful fruits and vegetables, kind of eliminating any fried food or inflammatory foods, and preparing yourself. So we talk to think about acupuncture, yoga, lower your cortisol. So if you're really stressed out at work, try to see what you can do to adjust your work schedule and see what you can do. The egg retrieval process there are 5 different protocols that we think about. Everyone is specifically tailored to your situation, your menstrual cycles, whether you have polycystic ovary syndrome, endometriosis or not, fibroids, any Asherman syndrome. We think about everything with you. But generally speaking, it takes 10 to 12 days of a medication called follicle stimulating hormone. It's exactly what your pituitary makes, and it stimulates the follicles to recruit them to grow. And there's about 5 ultrasounds and blood tests to decide, is the dose of the medications kick-starting enough of the follicles to grow? And patients always say, I want all my follicles to grow. So do I. But it has a lot to do with how you absorb the medication, hydration, making sure you're going number 2 every day. So I always ask, I feel like a broken record. I'm always asking about constipation and making sure you're staying hydrated and eating a lot of protein. Because if your pituitary thinks there's not enough nutrition here, it won't want to ovulate or do super ovulation, which is instead of ovulating 1 egg for the month, like we mostly do as women each month, we're trying to ovulate 5 to 20 eggs. And that's why the medication is there to be an ally to us. You can expect breast tenderness, headache, mood swings, thirstiness. And it's really important, again, to not do vigorous exercise, but a brisk walk every day is encouraged, as well as staying hydrated. The egg retrieval is a 15-minute procedure. I do them every day. It's under sedation, so you're as comfortable as possible. The needle goes into the ovary and we carefully obtain the egg. Our embryology team cleans off the egg, looks at the egg, the cytoplasm, the zona pellucida, and the polar body, and flash freezes the eggs if we're doing egg freezing, or fertilize the egg with the best sperm that we can get. Next slide. This is a beautiful image of the follicles. Each black circle has 1 microscopic egg, and the ovary is right here. And then as the medication is on board, each of those follicles expands and grows to a certain size so that the needle, which is the white line on the bottom, goes through, and we carefully get the egg out through the vagina generally. And then the egg is in the embryology lab and carefully fertilized or flash frozen. Next slide. In terms of embryo development, a fertilized egg is at the 2-cell stage. That's one of the big hurdles, is so you can get a group of eggs and then they need to fertilize to 2 cells. Over 7 days, they grow from 2 cells to 4 cells to 8 cells, up to a blastocyst, which is 100 cells. And they're able to take 3 cells off the outer rim. This is a beautiful depiction of an embryo having the few cells removed for genetic testing. There's been a little bit of a debate in the genetics world about those 3 cells. Do they truly reflect the inner cell mass, which is the baby to be? And there's been some sway in the world of genetics talking about that women over 35, your risk of Down syndrome and chromosome problems starts to go up. And so potentially that's where the pros outweigh any cons from taking the cells. Also, if your partner's over 50, there could be some potential benefit, as well as if you both carry a specific gene such as cystic fibrosis, Tay-Sachs, or any specific gene, we can target the embryo for that gene. In general, when an embryo gets tested, it also lowers the risk of miscarriage by protecting us from chromosome issues in the embryo. The testing of embryos is about 97% accurate. So there's a 3% of issues that we can't detect or that we wouldn't have been able to know about. And that's always a little hard to sort of tolerate as a genetics expert as well as a fertility expert. It's important to think about it. And for your specific case, your doctor will talk about all the pros and cons with you. Next slide. This is an image of the embryoscope monitoring the embryo developing over the 7 days. So 2 cells, 4 cells to 8 cells into this cool thing called the morula, which is a ball of cells, and into the inner cell mass and the trophectoderm. And this is a hatching blastocyst. Next slide. The embryoscope helps us decide which embryo could be better than the other. But patients always say, does it make the genetics better? No, we can't change the destiny of the egg and the sperm. It's sort of already a set entity. We're trying with our protocols to use a little bit of less medicine than in the old days. I've done this for 17 years and we've swung the pendulum of the doses of meds, but now we tend to use a milder approach, trying to get quality and quantity of eggs. And we've learned a lot about how to improve sperm. It takes 60 days to improve sperm. I feel like every day I'm having these heated discussions with men about vaping, CBD oil, avoiding too much ashwagandha or too much maca. So I always tell everybody everything in moderation, because that'll help us get a better outcome for you, because people who take something every single day can accumulate and may not be as good for you. In terms of genetics and testing and embryos, what has improved is that as we get into our later 30s and early 40s, by testing the embryos, there's some value in that because it also avoids placing an embryo that could have a chromosome problem and cause a miscarriage, or get to 12 weeks and have a tougher decision to make. And so it's important to think about it. And we work really tirelessly and hard and try to keep up to date with all the science here at SCRC to get the best success for implantation of the embryo for our patients. We have detailed checklists of things before the patient's allowed to have an embryo transfer. We really try to make the lining perfect, their body mass index. We talk about vitamin D levels, as well as hemoglobin A1C, and make sure their iron levels are good. We're working hard to get this to be optimal. Next slide. In terms of pregnancy rate, again, we have a very blessed pregnancy rate. We also prepare patients. So sometimes we also have to have a conversation that they need to talk to Cory for maybe 3 months or 6 months too, to if their hemoglobin A1C is worrisome, because that can influence early embryo development and spina bifida risk in pregnancy. So sometimes someone's gung-ho, I want the embryo, I want my embryo transfer, I'm ready to go, but perhaps they're struggling with their weight or some of their blood tests for their vitamins are off kilter. We'll have a conversation and talk about it. Next slide. Well, we have some promotions going on. This week's National Infertility Awareness Week. And I noticed when friends freeze eggs together, it's been a little bit happier joy together to go through the 10 to 12 days of injections. They have a buddy system. And we're here for you every step of the way. Slide. And all our doctors here give a lot of individualized, compassionate care. Our nurses work really hard to help you in any way possible for every situation you have. Next slide. Okay, Cory, thank you so much. I wanted to ask you a question. I was thinking, with the men, I always talk about walnuts and fish, and I have them add 4 cups of vegetables to their diet. But is there anything else I should tailor it for men too?
Yeah, there are some cool male fertility like supplements. And it's, when I talk to women who are like we're trying to conceive and I'm taking 90 different supplements, and then I'm like, what's your partner taking? Well, he doesn't like vitamins. It's like she's making all the changes. So there's so many things that men can do. There's a wonderful supplement called Belly, BELI. It's kind of like a male prenatal. And that's a really great way to just, like I said, kind of help fill in the gaps. But it's, a lot of the dietary stuff is very similar in terms of just more protein, fiber, those antioxidants, omega-3 fatty acids are great. So if you're not a big fish eater, trying to get in some omega-3 fatty acid supplements can be helpful. Inositol may potentially be helpful, along with some of the lifestyle, movement, stress, sleep, all of those things.
A lot of men lately have been asking me because they're doing like the really high protein kind of keto diet. And again, I say everything in moderation, but I worry about like too much of the meat and then hormones if it's not grass fed and things like that. I wonder but then they feel like they're all stronger and everything.
Yeah. I would say that they shouldn't ignore the importance of fiber and antioxidants. And, with that means including enough fruits and vegetables and nuts and seeds and beans and lentils, which aren't super, super, super keto friendly. So everything in moderation and definitely balance, right? So adding those foods to a diet that also has, ample protein and meats and things like that.
Yeah. When I have told men or partners to take vitamins, they tell me they feel more energy. Maybe their B12 is low too. And they're like, I feel a little better, like more zip to my walk and stuff. So it's been a good positive spirit. There are lots of papers about vitamin D levels in men with infertility, that if we can get their D towards 50, we'll see better sperm under the microscope for IVF. So I always talk about D.
Okay, very cool. Good to know.
There's a question for you in the chat.
Let's see. Is dairy milk recommended for fertility, or would you also recommend replacing it with alternatives? And any favorite prenatal vitamin brands? So you can definitely have dairy unless you're lactose intolerant, and you can also have non-dairy. It's really a personal preference. I do both because I like the variety. When you're looking at alternative milk replacements like almond, oat, hemp, whatever it is, try to look for brands that aren't really high in added sugars, because some of the fancy packaged ones, they do have a ton of added sugar. And I don't know about you, but I have a sweet tooth, so I don't want to spend my like sugar budget on like almond milk. I'd rather have my chocolate and like my, whatever I really, really enjoy. So that's how I like to look at it. Not that it's off limits, but something to consider. And then favorite prenatal vitamin brands, I make my own. I have a supplement line. So my prenatal is one that I crafted myself. And anyone can take it, whether or not you have PCOS. So it's called Vita PCOS Prenatal. I really look for vitamin D in there. I look for, of course, the right amount of folic acid or folate. I look for iron. A lot of prenatals don't have iron. And I'm like, what? Because we definitely need enough iron when we are pregnant. So I really like my own prenatal. And nutritional advice for males to improve fertility. Yeah, I think we kind of covered that just now. So that was helpful.
Antioxidants, more frequent ejaculation has been shown to improve sperm DNA parameters. So at least twice a week. And then men who have heat to the testicles, such as sauna, jacuzzi, long bike rides, or putting their computer on their lap or their phone right in their side pocket, isn't ideal. But again, I just try to not like worry patients so much, but everything in moderation. Once a year, a man should have a testicular exam with their physical exam to prevent any varicoceles or any problems with that area. Sometimes if men say their libido has changed, that can be also from an endocrine disruptors in the environment. And so we're checking a morning total and free testosterone. And some men tell us, oh, they're taking testosterone from naturopaths or from somewhere else, but then that can cause no sperm for 6 months. And so I always tell patients, don't take things that might have androgel, or sometimes some of the natural formulations are from actually testicles of animals and things like that, which give us energy, and men gives them libido, but then it can also have testosterone in it, which isn't ideal when someone's trying to get pregnant. And so I always tease out what they're taking in terms of any things from the gym or their coaches and things like that. And then for sperm DNA fragmentation, COVID caused a rise in problems with sperm DNA, but the beauty of it was 60 days later, it improved.
Okay.
So antioxidants, lifestyle improving, and getting circulation, getting exercise, that helped a lot too.
Got it. I love that. And one thing I forgot too is CoQ10 can be helpful for egg quality, but we also can see it potentially helpful on the male fertility side of things too. And with supplements, it's, supplements can be strong and powerful, and they can, make traction in various areas. So I always recommend trying to work with someone to understand what the best supplement protocol is for you. If we could get medication without prescriptions, we wouldn't just go cherry pick something that sounded good. We would find the right prescription. So some things we can take can be detrimental, and we want to make sure we're taking the right things. Another dairy question, whole fat versus low fat. Great question. We have so much conflicting research when it comes to the best dairy for fertility. When that's the case, when we see a lot of conflicting research, I tend to go middle of the road, and I tend to say, sometimes you can do whole fat, sometimes do low fat. You can do 2%, like 2% dairy. So we don't have any research that says, 100% every single time that full fat is way better than low fat, and don't eat low fat dairy, and vice versa. So I tend to just say, go with a variety. Sometimes I'll choose whole fat, sometimes I'll do low fat. It's just kind of a variety type of answer. I wish I had a better answer for you there, but
I also know the sense of fullness is a little more for satiety for PCOS, because there's some gene epigenetic changes that happen with polycystic ovary syndrome that kind of changes that sense of fullness for some individuals.
Totally.
And so with the whole fat, there's a fullness that comes quicker than the low fat. And for some people, that can change their daily caloric intake because they felt more full. I try to have patients tune in a little more to their sense of fullness versus that, especially like I said, when I get home from work, I'm kind of like, oh, I just want to eat and like sit and just like get my mind off things. And you have to really sense the awareness. That was hard for me, I have to admit, but like to get a sense of my fullness.
Yes, absolutely. Yeah. Well, and thank you for saying that. Whole fat is going to have more calories and more fat, obviously. So it can keep you fuller longer. If you are working on weight management, that's one thing to consider and factor in too. Intermittent fasting. The fast that I love to do is bedtime to morning to breakfast, that we kind of are on a natural fasting schedule anyway. I don't love super structured intermittent fasting just because, our body wants to feel safe. It wants to have regular eating patterns and intervals. And I feel like with intermittent fasting, it can really set us up to be in a more restrictive mindset. Like, oh, I can't eat because I'm not in my eating window. Of course, if you're fasting for religious purposes, by all means, go ahead. But just the whole intermittent fasting kind of craze, I'm not a super huge fan because I do really focus on blood sugar balance in my practice. And it's really hard to do that properly when we're intermittent fasting. So that's my quick
I have seen men where their semen analysis was super normal. 6 months later, they were doing intermittent fasting, and then the sperm looked really unexpectedly concerning. And I've seen that happen more than I can think of. So I always tell people, again, sort of the well-balanced diet, because your pituitary is very sensitive to the sense of lack of nutrition. But for me and some patients with PCOS, I think 8 p.m. to sort of 8 a.m. or 10 a.m., whatever you can kind of eke it out to, they have less, calories over the time you can eat. but you don't have to make it as restrictive, like you said, Cory.
Yes. Yeah, totally. I love that. Totally. Agree.
Yeah, so dairy does in some people cause inflammation, especially lactose intolerant patients. Patients with thyroid disease, I always tend to talk about try to avoid dairy, but then some of them are like, I can't give up cheese, and then I don't want to be like,
Yeah.
they
Cheese.
need calcium because the only way, especially when we get older, that your stomach really absorbs calcium well is through nutrition, because taking a calcium supplement has been shown to cause a spike and a peak and a trough of calcium, and our coronary vessels in your heart are like absorbing that, and that's too much calcium in a tablet. So it's actually better to get it through nutritional ways versus actually a supplement when we get, especially when we get older. And so there's a little controversy with dairy. I'd love to hear what you think. But.
Yeah. Oh, I know there's so much, and I obviously I focus on PCOS, so there's a lot to say there. I don't recommend. One reason why you should avoid dairy is if you have if you have acne. We do have research that dairy can exacerbate pre-existing acne. That does not mean that if you don't eat dairy or much of it and then you start eating it, you will get cystic severe acne. That's not what that means. But if you are somebody that struggles with acne, you can trial eliminating it, and that might be helpful for that acne problem. But yeah, it's a controversial hot topic type of food. And like I said, there's lots of conflicting research. So yeah, I tend to go everything in moderation. I'm kind of always working through like, what can I bring back into someone's diet? How can we not focus on restriction? So yeah, that's kind of where I'm at with dairy, and also keeping in mind that some of the dairy alternatives do have lots of, lab made ingredients and sugars and, artificial flavorings and artificial sweeteners. So that's just something to be mindful of too. So maybe there's not one perfect choice. But also it's not something that, I would recommend drinking milk all day long every day anyway, right? So if you're getting some regular like whole fat dairy milk or low fat dairy milk in a couple times a week, that's totally fine. If you're doing a dairy replacement a few times a week, that's totally okay too. Yeah. I think we got all the questions. Oh no, wow, I didn't even see.
Oh yeah.
I'm
One
sorry.
of them, how
I was
many eggs do you get on average?
80 grams of protein a day. So that really is going to depend on your unique body and health goals. So it will really vary per person. You'll want to work with someone, or to try to get into some kind of nutrition program, or to figure out what your macronutrient goals are. So it's really going to vary per person. Based on the other question, I'm doing intermittent fasting my first 2 weeks of my cycle, 13 hours a week, and 3 no more than 16 with no fasting week 4. Wow, wait. Intermittent fasting my first 2 weeks of my cycle. So I think that's kind of was answered by the intermittent fasting, discussion that we had. There's no one perfect way to do this. And I think just kind of eating regular meals and snacks, like, most of us are kind of pre-wired to do, is the best route to go. And then I will pass it to Dr. Alexander.
Yeah, the question, what is a good amount of eggs you'd recommend in a single cycle undergoing egg freezing? So every month you have a pool of antral follicles. Average is 10, but we're hoping to get more, because it does, at age 35 or below, it takes 15 or more eggs to get a chance for a pregnancy, because we cannot predict the future partner's sperm, and sometimes the semen analysis can be challenging. And so fertilization of those eggs may be lower than expected if there's a male factor, and we wouldn't be able to predict that. Once we're over 35, it takes more eggs because the genetics of the egg starts to change. The mitotic spindle gets sticky, and so the chromosomes, when they separate, they can have an extra piece of a chromosome, like Down syndrome and things like that. And no, even if we're as healthy as we can be and our hormones as good as we can be, as we age, genetics of our eggs kind of change. And so on average, we're trying to get the pool of follicles to develop and grow, and it's an individualized situation. We're using a protocol for your specific situation to get quantity and quality, but we're trying to get a good quantity for you with that process. Wonderful. Well, it's been such an honor and a privilege. And
Oh,
now,
I'm sorry. I missed the last one. Sorry.
was there another?
Oh,
Oh, yeah, there's
there
another.
was one more. And
questions. Oh,
I
yeah.
would say
Okay.
you never too early. Never too early. You could start tomorrow. The longer the
Yeah.
better. Typically, we like to say at least 3 months, but yeah, that's what I
Yeah.
say. Yeah.
Oh, what do we transfer mosaic embryos? We've been having big ethical discussions with that. I know some of my colleagues in across the country do transfer mosaic embryos. For right this moment, we aren't transferring mosaic embryos, but it's a ever evolving process here at SCRC. So we're open to discussing it, but right now our embryology lab doesn't have us transfer those, but we are saving them, but we have still yet to transfer them for now.
Cool. I actually do have to go. I'm so sorry.
Thank you, Cory. Thank you, everybody. I hope if you
Yes.
have any other questions, we're happy to do consults, and we send our love and good energy to everybody. Thank you so much for your time today, Cory. I hope you have a great afternoon.
Oh, yeah. Thank you so much for having me. All right.
Bye. Cheers. Bye-bye.